This patient was referred to me with a dislocated Tecnis ZC 18.5 diopter lens, which was placed about 5 years prior. Now, I always repeat biometry because I may not use the lens at dislocated. I may actually remove the lens and place a 3-piece lens. The interesting thing about this case, though, is there seems to be a discrepancy in the biometric reports. So the surgeon placed an 18.5 diopter lens, but the repeat biometry, if you compare the same lenses, the biometry here, the new report, is suggesting a 16 diopter lens. That's a 2.5 diopter difference. So when you see that, you know that there's something atypical. Now, I'm intending on placing a Tecnis ZA 9003, probably a 16 diopter lens in the bag, and that's what I intend to do for my Yamani technique procedures, but it still does not explain why is there a big discrepancy. And so this is when you need to dig further. So you can ask the patient, what were you corrected for? Were you corrected for distance, or were you corrected for up close? The patients themselves may not remember, especially if the surgery was many years prior. This is why it's important to get the original biometric data. And so that's what I did. I asked the original surgeon for the original biometric report, and you can see that he actually targeted for a minus 1.5, and that matches 18.5. So this explains the discrepancy that I'm seeing here between this and this. And why is this so key? Because if you're intending on placing a new lens, you may tell the patient that the new lens may not necessarily be for up close. Typically for the sutured lenses, I typically would recommend aiming for distance. But when you see this discrepancy, number one, you also have to look at your own biometry report and see if anything was put in incorrectly. For example, vitreous body, was it placed as silicone? Was the target refraction potentially incorrect? Was the lens status not the right status? But in this case, this was accurate. This was also accurate, and it just basically boils down to what was the initial target refraction. I hope you found this to be useful, and thanks for watching.